So today is the session of A attendees. Oh, here's a non-A attendee. Hi, Marnie.
Hi, Heidi.
I know, surprised. You didn't think you'd see me.
I didn't. It's a pleasant surprise.
Well, thank you. I appreciate it. Nice to see you too. You have just about 1 minute and we'll get started.
Often other sessions will bump up right against that ending time or even a couple minutes late. So then there's a mass first exodus and then input into different demonstrations.
Well, thank you for that heads up, Marnie. Maybe I'll give a 30-second, 45-second buffer.
Yeah, I think
Is that okay with you, Kayla?
Perfectly fine with me.
Okay. Thanks for that, Marnie. Oh, and here you go, Marnie, just as you said. We're just going to pause for about 30 seconds to get the last few people in. All right, well, we'll go ahead and get started. I want to give Kayla all the time that she has to share. So we want to welcome Kayla, where's my note? Kayla, I got it, Dixon. Sorry, my notes changed screen. She is the director of interprofessional in continuing education and family medicine at the University of Alabama in Birmingham. We're so glad that you're here to share with us the virtual IER. I have just a few comments to make before we get started. One is that you were brought in muted, so if you could stay that way unless the presenter prefers you to have your video on, you can have your video off. If you would remain muted until you want to ask a question. Kayla is going to give some data in the beginning of her session and then pause for questions to that and then hands on, and you'll be able to ask questions at any time at that point. This session is being recorded, just so you know that. If you don't want to record it, you might just keep your video off throughout the session. I will remind you, if you could please fill out the evaluation at the end. I'll put the link within the chat. And there we go. So thanks for letting me do all the details. And Kayla, we turn it over to you. Thank you so much for sharing the conference.
Perfect. Thank you so much. So let me just begin by giving a brief overview as to what I'm going to be talking about, because I know the title of the virtual IER is very confusing. So what we're going to be discussing is an activity that we designed within our Department of Family Medicine, and we implemented among our medical students who are involved in a program called CURE. So in the beginning, I will discuss the outcomes of that activity, and then I will provide a step-by-step how-to demonstration on how to recreate the same type of activity for your own curriculum. So today we are going to talk about the virtual IER, where teamwork and communication saves lives. So as I previously stated, this activity was designed for our CURE students. CURE stands for the Comprehensive Urban Underserved and Rural Experience Program. This program is designated for medical students, specifically those who are entering into primary care and wanting to serve in underserved populations. So the whole premise behind our CURE program is to give medical students early clinic exposure within the first 2 years of medical school. A part of that is within years 1 and 2 of medical school. They receive a 10-patient panel and they serve as a health advocate for those patients throughout the continuum of their medical school career. So they help patients do scheduling for appointments and do any type of screening or analysis that needs to be done. But they just serve as pretty much a health advocate for their patient panel. And in addition to their patient panel every month, the students are also involved with a number of educational curriculum requirements. A part of those are online modules, hands-on activities, flipped classrooms, facilitated discussions. So what we did with this activity is we created a virtual escape game via Zoom, because this was right in the middle of COVID and we wanted to create an interprofessional experience. And so what I mean by an interprofessional experience is we are striving to allow our students to work alongside and learn alongside other healthcare students also. So that includes dietitian students, physical therapy students, psychiatry students, dentistry. So in all the health professions that you can think of, our students learn alongside them in interprofessional huddles and collaborative opportunities. So what the students do is they, on a monthly basis, they come together and collectively work together and treat the patient as a whole, and look at a number of different aspects from mental to nutritional to medical needs and even social determinants of health to improve their health equity. But a part of this activity in and of itself was to provide a virtual experience for our medical students to learn collaboratively together, specifically learning interprofessional communication and teamwork techniques. So what we did was we created a virtual escape room. And when I say a virtual escape room, we created it on Google Slides. And what we did was we turned a typical escape room, since that's the new upcoming fun and adventurous way where young adults like to have a challenge, is we turned a patient case study into a virtual escape room. So what we did was, for every aspect that pertained to that patient case, the students would enter the virtual escape room and they would search for clues. When they found a clue, they would receive some type of medical riddle and they would try to figure out what that riddle was. And so they would type in on the virtual escape room what they thought the riddle was. And if they got it correct, then they would receive an aspect of the patient case. That could be anything related to patient history, lab values, etc., but something related to that patient case. The students knew going into it that they would need to collect 8 clues. So once they had collected all 8 clues, they knew that they had all the information needed to diagnose and come up with a treatment plan. So they would collectively work together to come up with a treatment plan. And then in the final hour, we would have a debriefing session with the providers where they sat down with the students and reflected on the experience and discussed their treatment plan. So upon this activity that we created, at the very end, we offered a feedback survey, because this was our pilot program and we wanted to know, was this a fun, adventurous way to learn how to work in teams and solve patient cases and treat and come up with diagnoses? And so upon our survey that we administered, here are a few responses that we got back. We did both qualitative and quantitative surveys. As far as the qualitative data that we collected, when we asked to describe any positive aspects of the IER activity, here were some of the students' responses. So they felt that it was a unique way to connect and facilitate participation. They thought it was a fun and it was nice to have a break from a traditional learning format. It encouraged mutual support and active listening, and it enabled to work with other providers and bounce ideas off of each other. The platform we used was interesting and a fun twist to virtual learning. A student really enjoyed getting to know some of the medical school students who they to work with them and solve patient cases. Another student said getting to meet other students and getting to use clinic knowledge and hearing others' opinions, they really appreciated. And then they enjoyed engaging with PA students who they otherwise would not have met. As far as the quantitative data that we collected, when we asked if the platform design was inviting and piqued their interest, as we can see, 57% agreed and 36% strongly agreed. When we asked, the IER activity provided me with interprofessional teamwork and communication strategies that could be applied in a clinic setting, 57% strongly agreed and 22% agreed. And also when we asked if the virtual escape room platform was a unique tool to explore case studies in the learning continuum, 50% strongly agreed and 36% agreed. When we asked what we could have done to improve the platform and those invited, the students said that they had so much fun with working with other discipline students that they would have liked to have a larger health discipline to pull from. So with our group, it was medical students and PAs and nurses. Going forward, they would like to work with outside disciplines such as dentistry, PT, and a number of different professions like that. So going forward, we would like to expand our offerings even further. So what we concluded from this experience was it afforded students the opportunity to practice interprofessional teamwork and communication through a modality that converged interprofessional principles, clinic practice, and gamification to elevate educational engagement across discipline lines. So we invited non-traditional teaching methods into the curriculum, ignites student curiosity, and transforms conceptual learning into applicative learning. With the change in culture and environment, contemporary instructional devices through gamification and simulation can be essential tools to heighten knowledge and a passion for learning. So that's just a brief overview as to what we did, and I will now walk you through a step-by-step on how to create a virtual escape game that can be applied in any topic that you would like to incorporate in your educational curriculum. Do we have any questions before we continue any further?
There's nothing in the chat.
Okay, perfect. All right, so you're probably wondering, how do you go about creating a virtual escape game via Google Slides? So what we did was we first began by creating an account. So if you're not a Google enthusiast, so here is a literal step-by-step direction on how to do this entire thing from start to finish. So once you have your Google account created, if you click up into this little app button right here, you'll get a drop-down box and you'll scroll all the way down and you will see a app that's called Slides. So you will click that, and then this is where all of your information will be input. So next, you will click a blank to create an actual true slide presentation. And so here is where all of your meat is going to be added in to your escape game. So the very first thing you're going to want to do is you're going to want to put in a background slide. This background slide is very integral because it will allow you to layer within your virtual escape game, and I'll explain what that means in just a few minutes. But this background image is going to allow everything to coincide within this one slide. And so you're going to build on top of this one slide. So when you go to try to find a background slide, you will need to make sure that that image is fitted for a background if you do a Google image search. So what you're going to do in order to incorporate your background, you are going to click the background button in your presentation, and you're going to have two options. You can either use an image saved from your desktop, or you can use an image from Google. I highly recommend utilizing a folder on your Google desktop, and any picture that you pull from Google, automatically save it to your desktop so that it's easy to access, because you're going to be accessing these images over and over again. So once you have determined what type of image you're going to use, whether that be through your desktop or through Google, you can then click whether you want to upload or do a Google search. So as I previously stated, just make sure whatever images that you find, make sure you save them in a folder because it just eases access. So once you have created your background, and you are going to want to type in, if you do a Google search, you're going to want to type in, say you want to look at a patient room, for instance. You're going to want to type in the word background patient room, because that background patient room will signify that that image is designated for a background. So whatever image you want to search, just make sure you type the word background in front of it to ensure that it's a true functioning background image. And then once you insert that background image into your Google Slides, you can now begin the process of layering. This process is a very integral aspect because this is where you're going to add all of your virtual escape room features. So what you're going to want to do from here on out is you're going to want to duplicate your Google web address and have two web addresses open, so that one you can see your presentation slide, and then for the other that you can add your clues into. So I just always duplicate the web address so I can just click back and forth between the two. So now that you have your background image, now the next step is we're going to truly create our clue. So we're going to go back to our original web page where we went to insert our slide, and we're going to scroll down to the app that says Forms. So Forms is where you're going to create all of your clues. No matter how many clues you have, you're going to use a Google form per clue that you have. So you're going to click Form. And now you can edit whatever clue you want and make sure to validate your response. So typically with an escape room, the best method of question is to be short answer. I know with a Google form, they have a number of different options from true and false or multiple choice, but to be true escape room-like, it's best to do a short answer. So you type in, give it a title, and then you type in whatever question that you would like. And then make sure you click the required button, and then hit the three dots down below and click response validation. This response validation is very imperative because it ensures that the student can't continue without truly typing in an answer and receiving a response as to whether their response was correct or not. So just make sure you put a title, a question, and then hit required and response validation. So after you have created the clue itself, now it's time to create what we like to call clue locks. So what you're going to do with these clue locks is, say for instance, a student doesn't input the right answer. Well, they're going to have to know whether they got it right or wrong. So the clue lock will prevent them from accessing the revealed clue if they don't get it right or if they get it wrong. So what you're going to do to create the clue lock is in this button right down here, you're going to make sure that the text feature has been enabled. And here where it says test, here is where you're going to put your actual answer for your clue. And so what you're going to do is, after you have your answer, you are then going to be able to fill in your custom error text slot. So what is this custom error text slot? Well, this slot right here has to be imperative because it's going to let them know that they got the answer wrong. So typically we like to use the terminology failed, try again. And so that lets them know, okay, we didn't get this right. I'm not going to be able to unveil the clue until I get it correct. So this lets them know that they get it incorrect and need to try again. So now that you have created your clue, you've created your clue lock, now it's time to be able to unveil whatever your clue is wanting to unveil. So here is an example for what we did for our virtual escape room. So what we did was, after we created the clue lock and it said that yes, they answered it correctly or no, they failed, when they're able to see the actual clue information regarding our patient case, for instance, what we did was we provided the patient's exam results. And the way that I did this was I did all of my imaging on PowerPoint, and a Word doc. And so what I did was I just pulled different images off of Google, and I saved those images to my desktop. And in order for me to create a clip art EMR system chart structure, I just went on Google and I got the basic EMR clip art chart, and then I added some added features with a little folder, a confidential sign, and then I provided a text box with all of the lab information. And so what I did with these images is I just layered them all on top of one another to make it look like a true EMR medical chart. And then I saved it to my desktop, and then I was able to upload the image into the actual Google form itself. When you upload whatever your clue is, you need to make sure that you put it in a separate section from your before you're locked, because that separate section is going to allow them to say, yes, I got the correct answer. Now you can go on to the next page. So make sure that you do not add your actual clue that you want to unveil in the same screen as your clue lock. So in order to make sure that you add the section appropriately, there is a little button. There is a little button right here that says add section. So with this add section feature, you can create whatever clue that you want to add in there as your information that you want to unveil to the audience. So what we did was we had one Google form per clue, so they would have to physically click around the virtual escape room to try to find all the clues. You can do it one of two ways. You can do it where the student is able to access all the clues in one Google Doc, or they can be in separate Google forms. If you do all the clues in one Google Doc, you will need to add a new section after every clue. So once a clue has been unveiled and you're ready for the student to go on to the next clue, you would just click add new section and just make sure that every clue is in a separate section. But as long as you only want to do one clue per form, then all you have to do is add the section at the very end when you unveil the actual clue itself. So just make sure you add the clue in the separate section. And now that we have created our actual Google form and the clues, what we're going to do now is we need to link our clue to the escape room. So in order to link the clue to the escape room, you're going to go to your Google form that you have created, and you are going to hit the purple send button in the right-hand corner. When you click that purple send button in the right-hand corner, you're going to get this screen that pops up. If you want to link the link to the actual presentation, you're going to click the link button right here, and you're going to copy this web address from Google Forms. So now that we have linked our clue, or copied our clue, so to speak, now it's time to connect it to an actual object in the room. So when we go back to our Google presentation, we need to insert an object, because right now all we are dealing with is a blank background image. So it can be any image that you're wanting to search, but you'll just go to insert, and then in the insert bar, you will click image, and then you could search, like I said previously, from your desktop or from Google itself. Anytime you insert an image from Google and you're searching for that image, you will need to make sure that you put the word transparent in front of whatever object you are trying to search for, because that transparent word will ensure that whatever images pull up do not have a background. So it's clearly just the image itself and no background. So that makes it very easy to maneuver throughout your presentation slide. So when you go to search your image, so we did, we were searching for a doctor for this object. We typed in transparent doctor, and then we were able to find the image that we wanted to add, and then we clicked insert, and our doctor inserted into the background slide itself. You may need to modify the scale so you can make the object bigger or smaller, and you can place it anywhere in the room that you want. So now that you have your object inserted into your background slide and you have your link copied from your Google form, now it's time to connect your link with your actual object. So you're going to insert the object and then link the object. So the link that we previously received from the Google form, we're going to copy that and we're going to go back to our object. And when you click on the object itself, you're going to have a number of options that pull up. One of those options is going to be a blank search bar, and you're going to be able to copy that link that you previously copied into and paste it into this search box. And then you're going to click apply. So from here on out, all of your links are going to be hidden so that they cannot be viewable to the student. And so when they click on the patient or the doctor, excuse me, when they click on the doctor, it will automatically send them to the Google Forms where they are going to try to solve the clue. And they'll jump back and forth between the Google Forms and the presentation for every clue that they need to try to unlock. So just remember that when you are connecting these clues into the objects, make sure that if the object is hidden upon clicking, that it takes you to the correct Google form. So make sure you don't get your links cross-wired because that can cause some confusion on down the road. So just make sure the right clue is connected to the right object. I know when we were designing ours, we wanted the clues to go in a specific order. So we had to make sure that the student knew how to access everything. And then in the once you have all of your objects linked appropriately, now we can start adding in the fun little extras. So what we did with ours is we added in a timer so that the students would see a true 60-minute clock ticking down in the upper right-hand corner. So in order to add a timer, you will go back to your background Google slide and you're going to click insert, and in the toolbar, you're going to click the option video. When you do that, you are going to get to search from your Google Drive or by a URL. So we searched YouTube and we found whatever 60-minute timer that we felt was most appropriate. We found this one at the very bottom to be the most feasible. And we click select and it automatically inserted the timer into the presentation so that when the presentation was in presentation mode, it automatically just started ticking down as soon as the student entered the escape room. Some other features that we added that was a nice little touch was we added a heart monitor in the background to make it sound like actual hospital noise. And the way that we did that was we did it the same way. We went and searched for a video and we found the sound that we thought was best appropriate. And when we inserted that sound into the patient room, we hid the object itself so that they would not see that video. And the way that we hid that object was we made it be a transparent image so they couldn't find where the actual sound was coming from. All they could do was hear the sound in the background. So here is an example as to what an overview of an escape room would look like, but this is how you would create it. And I'm going to show you just a small summary as to what our patient room looked like for one of our cases that we utilized. So here was our patient room. And as you can see, the clock is ticking down in the upper right-hand corner. And if you can hear the heart monitor in the background, see, you can't see it anywhere. So it is very hidden. And so when you're in this virtual escape room, you can see it looks just like a hospital room, and the student is able to click in anywhere in the room where they want to go. So So let's say we want to click on this picture frame. Hopefully when I click on it, are you still able to see the thing? Yes, you should still be able to see it because I switched screens. Okay, so when you click on the picture image, you are going to have the Google form clue pop up. And so this was just a simple little riddle that the students would work collectively on to figure out. And then the answer to this was white coat syndrome. So I would type in white coat syndrome and I would click next, and then they would receive another clue. And so what they would do with that information is, when I said that the clue was X marks the spot, a part of interprofessional education is utilizing a communication method called SBAR. So what they had to do was they had to collect all the letters that spell SBAR, and then they had to create their SBAR for their patient diagnosis. So what they did was they collected all 8 clues. Some were related to the patient case, some was related to our communication techniques. It was just a variety of different modalities to help them truly understand what interprofessional practice was and to work collectively as a team and utilize effective communication skills. Are there any questions in regards to the presentation and how to create a virtual escape room?
I have a question.
Okay,
So
perfect.
I just love this idea so much, and visually it really looks amazing. Looks like they're in Denver. By the way, I noticed. What I was wondering is, so then for well, 2 things for your classes, how are students accessing the escape room? Do you provide a Google link and then students, follow that link to the escape room?
What we did with that was we were all in Zoom, and then they were already in designated breakout rooms. And so when they went into each designated breakout room, I would just send them the web link, and each group had a different case study that they were focusing on. And so they just opened up the chat and was able to access that web link that I sent them directly.
Got it. That's great, because then you can troubleshoot on the spot if necessary. And then my second question is, when students are entering the short answer portion, once they're in the escape room and they need to enter the short answer, I'm assuming then, if that's sort of an auto grade, that there are specific words that you're looking for?
Yes. So it was definitely auto graded. Since ours was so patient driven, the clues that we were giving them were answers that they should have known at their educational level. So we made it very focused so that it would be something that they would be able to figure out. And then we just let them know ahead of time either to not use capital letters or to only use lowercase, because it was so specific. So if a student does a spelling error or does a capitalization error, it's going to mark it wrong. So the students definitely need to know whether to use uppercase or lowercase.
Got it. Thank you.
Are there any other questions?
No questions in the chat. There's a thank you and you're awesome. Well, the presentation is awesome. So, which is you. So,
well, thank you very much. If there's no further questions, this concludes the presentation. But if you ever need any assistance with virtual escape game design in the future, I can gladly help you. Just email me and I'll gladly walk you through it.
Are you sharing your slides in the presenter Discord or?
Yes, I am. Mm-hmm.
Great. So if you haven't checked out Discord, that's the place to be.
I don't think I can share the game link in the chat because it's specific to your Google Drive account. And so I don't know that you will be able to access it. How long does it take to create the escape room? Well, that's a good one. It took me about 3 weeks. Probably longer for me because I was having to learn my own way through it. and was having to figure it out on my own. Now that I know how to do it, I could probably do it in about a week. But if you've never done it before, it would take about 2 or 3 weeks, I would say. Are there any other questions? Perfect. Well, it has been a pleasure presenting, and I hope you found it very informative.
Thank you, Kayla. We appreciate your time.
Thank you. Have a good day.
Oops. Hi, Clint. The session just ended.
I'm so sorry to have missed it. I was coming in late, hoping to catch the last half.
No, she finished early, but she did say she's going to put her slides in Discord. And
Okay.
so,
I
yeah,
imagine it was recorded and I can catch
yes,
all of that.
yep. Well, in fact, it was still being recorded.